Welcome to the session on preparing for the MMI at the University of Calgary. I'm your host, Kevin. Thank you for taking time out of your Sunday evening to be with us. So today's focus is on MMI preparation and your interview day. Now, we have a lot of webinars on different topics, so if you want our Casper webinar or something different, please give us an email and we'll gladly send it to you. And here's about me. I'm a medical student at the Mayo Clinic Alex School of Medicine. And I got into both Canadian and US medical schools this past cycle. It was my second cycle applying. My first cycle, I only applied to Canadian schools. And I got 2 interviews, McMaster and Ottawa. McMaster is the birthplace of the MMI. And I got waitlisted and I got rejected. Okay, so it wasn't a good cycle for me. But the second cycle, I got 9 interviews across US and Canada. It was 4 in Canada, across provinces, and 5 in the US. And I got into both Canadian and US medical schools, and now I'm at the Mayo Clinic, the #1 hospital in the world. So very fortunate. If you have questions about applying to the US or anything, please feel free to ask me. Okay? And the focus of today's session is the secret to the MMI. What is the difference between great answers and extraordinary answers? Now, the format of your interview, I'm not going to bore you. I mean, if you don't know this, I'd be a bit concerned, but you know your format. It's an MMI with 8 stations. And the thing is, in these MMIs, a big focus is hot topics, okay? The opioid epidemic, homelessness, barriers to care, social terms of health, right? Medical assistance in dying. You need to not only have expert knowledge, like the facts, right? Oh, okay, 2021, there was a amendment made to the medical assistance in dying laws in Canada. Not only do you need to know the facts, but you need to be able to provide an expert opinion on these hot topics, okay? And this is a list of stuff that are related to healthcare that you could be expected to know, and they could come up in your MMI. But here's the thing. The first cycle that I applied, and that was the cycle I got interviews and I got rejected, I had knowledge on all these topics. I was able to provide expert answers on all these topics. So why didn't I get in? Now look at this. What if you thought outside the box, okay? There are other topics that affect society as a whole, like energy, the Albertan economy, climate change, right? Cancel culture, the wealth gap. I have been in Canadian interviews where they've shown me a map of the world, and they've been like, it just shows like the wealth distributions in different like parts of the world. And it's like, interpret this graph and provide an opinion on it. Right? I've been asked about cancel culture so many times in my interviews, US, Canada, doesn't matter. And now I'm like, man, I just got asked a question on like cancel culture, and I've been studying organ donation for the past 2 months, right? I've never been asked anything about organ donation. Like, and I'm just like laughing at myself, like, what did I do wrong? So the second time that I interviewed, that I applied, I started looking into all these expanded topics, these hot, important things that are going on in society in Alberta and Canada and beyond that are maybe not directly relevant to medicine. But here's the thing. The economy, the housing crisis, right? Like different things like this, wealth gap. If it's something that affects everybody, it becomes a question of public health. And public health is a huge idea. It's a huge theme in MMIs, okay? So if something is public health related, even in like an indirect sense, as a future, medical professional, you should be able to provide an expert opinion on it, a mature expert opinion, right? Like, is war good or bad, right? You should be able to provide opinions on those. So I always think the best way to practice, to learn, is via practice. So let's do this question together. Imagine you're a physician and you encounter a patient with chronic pain who requests opioid medication. How would you balance the need for effective pain management with the risk of opioid addiction? All right, I'll give you all a few seconds to think. How would you answer this? You could start off by saying, I would conduct a comprehensive assessment of the patient's pain. I would have open conversations with the patient about their pain experience and treatment history, right? If opioids are necessary, I would proceed with caution, starting at the lowest dose to avoid dependence. I would revise the treatment plan with the patient periodically, which means I'd regularly review it and adjust as needed. And then you could give your conclusion. So this is an answer that addresses this question. I want someone in the chat to either unmute or just put in the chat, yes or no. Is this a good answer? All right, is this a good answer to the question? Yes or no? Just put in the chat or unmute. And I promise you, I will not go to the next slide until we do that. Here's the thing. This is the sort of answer I would have given the first time I interviewed. And I'd be like, well, I crushed that interview. I gave, I addressed the question in a very mature way. If you saw this and I told you like a clinician said this, right? A real clinician, you wouldn't doubt me. This is a very mature answer that hits all the points of the question. But I would give these answers time after time, and I didn't get into any medical schools the first time I applied and interviewed. Now let's look at what else we could have done. What else could we have said in this answer? I could first explore a multidisciplinary approach to treating pain. For instance, physiotherapy, lifestyle modifications, exercise, or diet. I would educate the patient about the risks of opioid use and how we can minimize these risks to build a trusting doctor-patient relationship. And what if we went even farther? What if we made connections to the opioid crisis? There's an opioid crisis affecting every metropolitan center across Canada. Okay? Calgary's no exception. What if we talked about the sickle cell disease and racism with respect to opioids? Did you know that Black populations, sickle cell disease is more prevalent in Black populations? And then if maybe a young Black man comes to the operating room, the emergency room, the ER, and they're in pain, they have sickle cell anemia, and they're in huge pain, and they need medications for their pain. And then the ER doc might be like, oh, well, this guy just wants opioids, right? So there could be stereotypes that really affect the patient's health in that setting. You could discuss specific medical cases relevant to Canada or Alberta. You could briefly talk about the science of opioid addiction, right? Maybe you've taken a cell biology class and you can talk about reuptake, norepinephrine. Obviously, don't spend too much time on it, but just as a way to go beyond. You can mention your knowledge of things like naloxone training. Maybe you've done street medicine programs and you've administered naloxone, or you've trained in using naloxone and so on. So there's a lot of cool ways that you can stand out. And this is what I started doing the second time I interviewed, and what helped me get into Canadian and US medical schools. All right, I went from this first answer to the second answer, and this whole presentation is about getting you from here to there. And by the way, all the questions we're using today come from our website, thebrightdoctor.com. We have question banks on things like the MMI, Casper, and this one comes from our opioid crisis mini question bank, okay? Along with that whole answer you just saw. And ideas to go beyond, like you could have also said, you could advocate for the use of state or provincial prescription drug monitoring programs to track opioid prescriptions. So Alberta, like all the provinces and territories, they track who are the physicians prescribing opioids, how much are they prescribing. It's called opioid stewardship. And you want to make sure like there's no red flags, there's no prescriptions that are physicians that are overprescribing opioids. Now, why do we need to give those extraordinary answers? Why can't we just give a mature answer and just call it a day? Okay. The thing is, like, some people can, especially if they're very personable, they can look at a camera, they have a nice personality and they're very phenomenal speakers, but I don't like to rely on those odds. The thing is, there's hundreds of people interviewing every cycle, and you all deserve to be in medical school. You all deserve that seat. That's why you're being interviewed, right? They've seen your application, they've seen your scores, your GPA, they've seen your activities. And everyone is phenomenal, right? You're in the very small percentage of people that got an interview. But out of the people who interview, what, only 30, 40% get in? If you consider waitlist movement like 45 max. I don't like those odds. So you have to be able to stand out in your answers. You have to be able to say things people are not saying, especially in an MI. And for me, this is a cartoon I really like, which illustrates my point. The first year I was one of these people. Okay, you're pushing along. Who are these people? These are people that they get an interview. They're like, wow, I'm going to go buy the book Doing Right and read about like non-maleficence, beneficence, autonomy, justice, and is that it? I don't know. I never read that book. Listen, that's probably a great book, right? These are the people that listen to the CMAJ podcast, White Coat Black Art. These are amazing resources. I'm not saying anything against the resources. I'm just saying, how are you going to stand out? How are you going to provide something unique when everyone's graded on a Likert scale, right? Everyone's giving a great answer. Everyone's giving a very great answer. How are you going to stand out if everyone's doing the same stuff? So what I started doing, I became the second person in my second cycle. And the rest of this presentation is going to tell you how I went against the grain to not be stuck in this trap. Okay. And the second time that I interviewed, I really distilled standing out to 5 things. It's like, I call it the cheat sheet. It's like, there's 5 ways to stand out. And I distilled down to this. It's either you're going to address more perspectives than others. You're going to offer more alternative solutions than other people, more creative solutions, or how to avoid certain issues in the future. You're going to be a better speaker than others. You're more personable. You have more organized answers, less ums and ahs. And you look at a camera and you speak with confidence, right? For instance, you could say, I could say to you right now, the average length of a giraffe's neck is 20 feet. And you'd have no reason but to believe me, because I can look at a camera, I'll tell you that with conviction. But I just made that up, right? So just doing that will get you so far. And a fun fact, like I like to tell people, go look at political commentators on YouTube that you find interesting. Obviously, don't do too much because politics will get you, pissed off all day. But just watch the way they talk, right? Find a really popular political commentator and just copy their mannerisms when they speak. Because if someone talks about politics all day and they make a living off of it, I mean, then they're pretty good at saying BS, right? So it's like they're probably really good speakers. So definitely check out how these people are talking and try to just steal their mannerisms. Make connections to your personal life, to your future career, or demonstrate domain-specific knowledge. So personal life, in the opioid question, you could have talked about, the naloxone training programs you might have done. Specific domain knowledge, you could have talked about opioid science a little bit, right? And explain why. So I know people in their MMIs, they're like, they think if they say the craziest answer, they're going to get ahead. Oh, I think we should solve this using AI and virtual reality. And then it's like, well, why? Like, why do we need to use virtual reality on like a chronic pain patient, And they don't really explain why. So you can really stand out just by explaining why in your ideas. And let's look at this guy. Everyone knows this guy, a smart aleck. This is the person in your class who just talks condescendingly to people. They talk like they know everything. And the issue is really, smart alecks make it pretty far in the interview process because they can look at a camera and speak with confidence, okay? So don't be a smart aleck, but at least, when you have these amazing ideas, the worst thing you can do for yourself is not be this pleasant speaker, a personal speaker, and having organized answers, okay? Really work on the search section. That's why I bolded this. Look at a camera, speak with confidence. Now, should you speak for the full time? Typically, no, but when it's asynchronous, yes. So because there's asynchronous, no, there's going to be like follow-ups. So in general, in my experience in MMIs, I answer for like 3-4 minutes max, right? And the thing is, like, if you miss something, I find that they want to help you and they'll be like, oh, well, cool, what about this? And they'll kind of ask a follow-up question that probes you and lets you get those points back. Yeah, so yeah, I mean, that's definitely general advice. So this is our general webinars. But in-person interviews, I mean, look at the person's eyes and speak with confidence, okay? A lot of people, I mean, that's even harder, in fact. That's even harder, like being able to look someone in the eyes. So really practice that. And when you're at home, I mean, with friends, that's a great way you can practice. So thank you, Evan, for that comment. This was for last year. So should you go in depth or broad? So if you're asked an MI, should you go in depth on one topic or broadly talk about a few? Okay. And my general approach is I will talk about 1 or 2 things very deeply. And I will kind of acknowledge other perspectives either before or after my answer, just so they know, okay, I'm acknowledging there are these other perspectives that I might not have had the time to talk about. So that's my general approach, and that'll get you pretty far. All right. So if there's any questions, just please type in the chat. Let's do another question now. Specific to Alberta. So given the recent initiatives to stabilize and improve primary healthcare in Alberta, how would you propose to further enhance accessibility to healthcare services in rural and remote areas? Okay, I'll let y'all think for 10 seconds on what you think your answer would be. You can give an introduction, okay? And I'm just gonna skim this. So Alberta's healthcare system is actively evolving with the Modernizing Alberta's Primary Healthcare System Initiative, the MAPS initiative, and a $200 million investment to strengthen primary healthcare, particularly benefiting Indigenous communities. Beautiful. So I really like to use my my first part of my answer as kind of like, oh, my background. Like I know stuff about this. So when I'm answering a health policy question, I always start out with like, first I'm going to talk about, I give a organizing sentence. First I'm going to talk about my knowledge on the subject. Then I'm going to talk about the pros and cons, and then I'll give my opinion, and then like a personal experience. So I always use the first part of my answer as talking about my knowledge of what's going on before I delve into answering the question, just so they know, oh yeah, this person's values understanding what's going on around them, especially in the healthcare system. So let's look. The first step to enhance accessibility in rural areas is leveraging technology. Telehealth has emerged as a vital tool during the pandemic, and its continued expansion could significantly benefit remote communities. By offering virtual consultations and remote monitoring, healthcare providers can overcome geographical barriers, ensuring timely and efficient care. This approach not only reduces travel time for patients, but also allows for better chronic disease management and follow-up care. Beautiful. We immediately start answering the question in very cool ways. You know, we can use telehealth. Another critical aspect is workforce distribution. The current initiatives include a focus on supporting family doctors and nurse practitioners, with each provider eligible for up to $10,000 a year to help more people. This funding could be strategically used to incentivize healthcare professionals to practice in underserved rural areas. So using monetary incentives to bring people into rural areas. Furthermore, integrating nurse practitioners and physician assistants into rural healthcare teams can expand the scope of accessible services, ensuring that residents receive comprehensive care. Beautiful. Now let's look how we start going beyond. Collaboration between healthcare providers and communities, especially Indigenous communities, right? So we're not even talking about Indigenous communities, but now we're saying, okay, I've done my research. When you're talking about rural and remote areas, a big patient population, a big vulnerable patient population there is Indigenous communities. So now we're going beyond, is also essential. The formation of an Indigenous health division within Alberta Health and a $20 million fund for Indigenous communities to develop their own primary healthcare services are commendable steps. Wow, like you're saying exactly things that Alberta's doing. And that shows you've been in the hospitals, you've been in the system, and you know what's being done for this vulnerable sector of the patient population. These initiatives must be community-driven, respecting the unique cultural and health needs of each community. Building trust and understanding cultural sensitivities are key to successful healthcare delivery in these areas. And lastly, additionally, addressing the vaccine hesitancy as seen in the low vaccination rates in Alberta is crucial. Educational campaigns tailored to rural communities, emphasizing the benefits of vaccination and addressing misconceptions can improve public health outcomes. Not only did we give relevant knowledge of Alberta policies to address, your understanding in the first area, not only did we give a multifaceted way of addressing the topic, but we're giving them more. We're giving them innovative ideas. We're giving them even more than they asked for. And this is how you go beyond. You answer things that they haven't even asked you, but that are relevant, that are very mature, and they show your understanding of Alberta, of the healthcare system, and what's going on. So Rochelle asks, would it be beneficial to argue both sides of the situation, or does that make your position seem weak? For example, telehealth's benefits, as explained earlier, but also the downside is that we lose personal connection between physicians and patients. Rochelle, that is beautiful thinking, beautiful thinking. So the way I would do it is I would mention, like very briefly again, at the beginning or at the end, we can use telehealth. Although telehealth has the downsides of, losing the personal connection, it is outweighed by all these benefits in connecting with this vulnerable patient population. And in a few words, maximum a sentence, you talk about the alternative viewpoint so they understand, okay, you're not blind, you're not blindly saying stuff. And then you go in depth into your opinion, okay? So that's how you don't come off wishy-washy. And again, there's always ideas to go beyond and avoid in our question banks. So you could say, you could partner with local educational institutions to provide hands-on training for medical students in rural settings. Wow. Like, this is like, you're at a medical school interview, you just said this, like you might as well be designing that medical school's curriculum. Like this is a beautiful, amazing idea. Encouraging the use of local health workers as liaisons to bridge the gap between healthcare providers and rural communities. Promote research initiatives, focus on rural healthcare challenges and solutions. Amazing. And avoid, avoid one size fits all solutions for different rural areas, right? And so on. There's red flags always to avoid. So now we're going to the last section of our presentation. Are there any questions? Okay, if there's a question, just put them in the chat. So first impression. So whenever you're talking to someone, obviously smile, and especially, you're going to ask questions on your MMIs, smile, with whom do I have the pleasure of speaking with, firm handshake. Of course, the etiquette, and etiquettes are always evolving, especially with COVID-19. So please refer to your emails for that. But first impressions matter a lot. Have like a first sentence you're going to say for every station. Oh, hi, my name is Kevin. It's a pleasure meeting you. Pleasure. With whom do I have the pleasure of speaking with? And then memorize their name. And then at the very end, say thank you. Thank you, Dr. Locke. Thank you this. Thank you that. And it just shows, okay, you memorize their name over the course of that entire interview, especially if they don't have a name badge, right? That's another way, a subtle way you can stand out. So, personal questions. This is, some people think, oh, I'm not doing a panel interview. They're not going to ask me personal questions. They very well could, and this could very well be in the form of a follow-up question, okay? It could be a follow-up question to even like an ethics or a policy question. It could ask you, okay, when is a time you have collaborated with others? It's kind of like the Casper. You know how you can be asked like a follow-up question, a personal one as the third question? So look at the CanMeds roles and have 2 to 3 stories for each of them. This is the American list, which I like a bit more, but you could look at CanMeds. And for like resilience, for problem solving, everything, have 2 to 3 stories about your life that address that pillar. And the way to answer these is using the STAR method. Situation, task, action, result. Okay, so if we're going to answer this question, what is the biggest challenge you've overcome, which I've been asked in so many interviews, MMIs, panels, US, Canada, different provinces, different states, they all ask you this. Or almost all of them ask me this. And it's usually phrased differently. Like, for example, what skills do you use to overcome challenges? Or name a time something didn't go so well. How did you deal with it? Right? It's the same question. So your stories can be very versatile, and your story for this, it'll hit resilience, it'll hit problem solving, it'll hit overcoming conflict, it might hit communication. So your stories can be versatile in addressing these personal questions. So last semester in the McMaster Biology Society, while organizing a programming skills workshop for first-year students, we encountered an unexpected vendor cancellation, leaving us without crucial materials. I was tasked with swiftly finding a replacement vendor without overshooting our budget. S and the T are right here. Get those out of the way. Get those out of the way as quick as you can. You know why? The reason is you don't get any points for those. You could be saying, oh, I was in the Prime Minister's office curing cancer. It's the A and the R that get you your points. It's the A and the R that talk about who are you? What are your values? What are your problem solving skills? What are your skills in general? What skills do you go to in different situations? Okay. And obviously you integrate the CanMeds roles into this and the R section. Now, the STAR method, and I think I invented this. If I didn't, you can let me know. It's missing a letter. It's missing a T, which stands for takeaway, okay? And I always have a takeaway at the end of my personal stories. So if we're looking at the same answer, right? Obviously, this isn't like the biggest challenge, but it is a challenge nonetheless. Imagine we say the same answer, but at the end we say, as I pursue a career in medicine, I will continue to draw on such skills to stay collected in rapidly changing situations. Through strong communication skills along with problem solving, I will continue to ensure team needs are met for the benefit of my future patients. This is beautiful because this is such a mature way of relating your entire story and these skills that you showed in the context of medicine. It shows that you've been thinking about what is it like to be in medicine. You've probably been in volunteering, you've been in hospitals, and you've seen medicine because you're able to provide this very powerful reflection on how your skills are going to help you in your future career. So as a future physician, as a medical student, I always had a takeaway, and I would have a takeaway for every one of these pillars. So look at all the CanMeds items and have a takeaway. Because look, you could be asked, it's like a hack. It's like a hack because you could be asked a question on communication or like collaboration, right? In your MMI or something that has to do with collaboration. And then you could give a great answer. And at the end, you're like, well, I wish I could say some more. And I would always have something ready in my back pocket, like as a future physician, I'm going to be in multidisciplinary teams, providing team-based care, holistic care to my patients. And it's important that I learn to work with people from all walks of life. And I would have this like rehearsed takeaway for each of the CanMeds pillars. So I could just like pull them out. You know, it's like pull them out of my belt and just boom, an amazing takeaway, a beautiful conclusion to my argument for anything and everything. So I would have a takeaway for everything. And I urge you to do the same. Your personal stories should reflect your values, your future career, like I said, if they can, the CanMeds roles, and the medical school. Okay, so this is something nobody does. I think I might have been the only person in all of Canada who did this last cycle, but because I was interviewing with the US schools before I came to the Canadian schools, because they interview earlier in the year, the US schools, I mean, the way it works here is there's over 150 medical schools. If you're a top applicant, you apply to 30 medical schools. You get interviews at 20 medical schools, and you get into 10 medical schools, okay? So I don't mean to ruin your Sunday night, but that's how it works in the US when you're a citizen, which I wasn't, but I was an international student. I am right now. So they would always ask you, like, why do you want to come to this medical school, right? But the thing is, in Canada, you're lucky to get a single interview. You're lucky to get a single acceptance. They don't really ask you that, although I have been asked that before. But nonetheless, what you should do, like I would have a lot of knowledge about the medical school. Like look at Calgary, look at the Cummings School of Medicine. Go on their website, click all the tabs, click every single tab. What global health opportunities do they have? What research faculties do they have? What clinical rotation sites do they have, right? And there's so many ways, like you could integrate this in your MMI answers. And I would almost like laugh to myself. Like I knew no one was doing this and it would help. It was like a life hack. It would help me stand out so well. Imagine you're asked a question on like rural health, right? Or like indigenous health. And then you're like, you know what? I know that Calgary has clinical rotation sites that as a fourth-year student, I can go to like this rural place or this, you know, this place in this like indigenous land, and I can provide healthcare there. And it's really going to help me develop my skills in addressing the needs for that patient population. Wow. Like I guarantee you, no one knows this. No one's looking up. Where are the University of Calgary's clinical rotation sites? No one's looking this up. It's like the most like the first thing you would do if you're applying to an American school is have like a really nice list of stuff you like about that school in case it can come up. Here's another example. I was asked a question about antibiotics in one of my interviews in Canada, and I mentioned, oh, I know that your school has one of the premier antimicrobial resistance research laboratories in the nation. And as a medical student with my genomics background, I would love to contribute to that. Wow, like this just helps you stand out. And it's such an easy thing to do. Spend one day researching the heck out of the Cummings School of Medicine and Calgary and everything it offers. Okay, so last section, this is like pro tips. So organization, this is about letting your amazing answers get the recognition they deserve. So again, you could say, you know, you're in person. I'll begin by discussing my knowledge of the situation or my knowledge of of the topic, and then I'll address the pros and cons of implementing such a health policy before giving my opinion and then relating it to an experience I've had in the area. If you can say, if this is your first sentence, you have already stood out, because your interviewer has heard the same like GPT boring answer to the same question 20 times. All right, because I told you, everyone's doing the same stuff, everyone's saying the same things. But if you can say this organizing answer, it will help them follow your argument very well, which automatically makes you stand out. Because other people, they start talking and then, you know, they forget what they're saying, and maybe they think of some other cool idea in the middle, and then they go on a tangent and forget the rest, and they start rambling. When people are making those mistakes, don't be that person. This will help you stay on track. Plus, when you say you're going to relate it to an experience you've had in the area, wow, like you give them something to look forward to. Because look, everyone's saying the same stuff. Everyone's saying a great answer. They talk about pros and cons, blah, blah, blah. Like they've heard the same thing 20 times. But now you're like, I'm going to give you a gift. At the end, I'm going to talk about a personal experience. So now it's like something novel for them. It's going to be something cool. Automatically you're standing out because you have this personal experience that nobody else has. that makes it very cool. So avoid extreme stances. Everyone thinks I'm wasting their time telling them this. They think, oh, obviously, Kevin, like, why? Who doesn't know this? But no, it's more nuanced than you may think. Let's look at this question. Should pharmaceutical companies be allowed to provide gifts, such as free samples of their latest medicinal compounds, to physicians? And I guarantee you 90% of people, probably more, 90% of people who just read like books on like maleficence, non-maleficence, beneficence, whatever, they're going to be like, no, this is a conflict of interest. You can't do this. This is bad. Pharmaceutical companies, oh, so bad. They're the worst. No, right? You can expect all the pre-meds giving that answer. But let's think for a bit, okay? And I'm not saying that's wrong. I'm not saying it's not a conflict of interest. But let's think. In Canada, we have Medicare, which means that our healthcare is free at point of service. But we don't have pharmacare. We don't have free drugs. If you want antibiotics, if you need like, metformin or whatever for your chronic condition, you're going to have to pay. You're going to have to pay for that. Maybe you have insurance from your parents, or maybe you're using some governmental program, but drugs are not free in general. So what if the pharmaceutical company was giving you a sample of a really cool drug, and not a cool drug, well, a drug that is like very expensive, and then you have patients who can't afford it, right? They need this drug to manage their chronic condition. They need it. Maybe it's life-saving, right? Maybe it's going to save their lives. And now they can't afford it, but because you got the samples, you're able to give it to them for free. Amazing. What if it's actually like a really good compound, and maybe there's laws now because people are always thinking pharma companies are bad. Now the pharma company can't market to you, so you don't know about this amazing medication, this amazing therapeutic that could have been instrumental in better managing someone's chronic condition. So even if someone seems so evil, please give it like a little bit of time to consider their perspective, because it will make your answer so much more mature. I'm not saying you have to agree with the evil, agree with that side. You can still say it's a conflict of interest and go on, and it's probably the right answer. But I'm just telling you, acknowledge the other side, and your answer will be so much more mature and help you stand out by virtue of that. Study at night. So when I was a teen, I read this book called The 7 Habits of Highly Effective Teens, and it said whatever you do an hour before you go to bed gets replayed in your head up to 6 times more than anything else you did that day. Now, I don't know how true that number is, but I believe it, because if you go like watch the news before you go to bed, and it's like this person got murdered, there was a shooting, there was a robbery, blah, 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 you're not going to have good sleep, okay? If you go watch a horror movie before you go to bed, you're going to have nightmares. If you watch a horror movie at like 7 a.m. in the morning, there's a way less chance you're going to have nightmares. So I would always study from like 7 p.m. up until like when I slept. I would study throughout the day as well, like every free second I had for my interviews. And I would just do this. So it's the last thing I did before I slept. And the perspective-taking mindset, which is so important for the MMI, wouldn't become something I memorized, right? These opinions I'm offering wouldn't become like facts I'm memorizing for interview day. They would become part of my way of thinking. They would become ingrained in just the way I talk and how I think. So everything was so natural on my interview day. Also, where everybody was listening to the same podcast, reading the same books, I would just go to the gym, put on like Nature Biotechnology, MIT Tech Review, Stanford Future of Everything podcast, Wall Street Journal, Financial Times. I just listened to things on like economics, finance, technology, everything. And they really helped me have cool ideas and ways to address problems that are beyond what you're going to find on like healthydebate.ca or cbchealth.ca. These are great websites. I'm not saying they're not great websites. I'm just saying if everyone's doing that, how are you going to stand out? And dynamic living. I see your question in the chat. The Q&A is super soon, so I'll get there. So zoom out. This is not relevant anymore. This is relevant to last year. So you're in person now. Share videos of answers with colleagues. So on our platform, you go to the medical school MMI question bank or any of the mini banks. And when you don't have friends or when you're not around, you can record. You can use our platform to record yourself. Like, what would you do if you were asked to complete a task you've never done before? And you can give yourself time to think. You can structure it exactly like your Calgary interview, okay? And then you give yourself time to answer, right? So I'm going to give an answer. And then you can finish. You can review how you talk. Are you speaking well? Because then these skills will translate to your in-person. And then you can view other people's comments, people leaving, that was a funny comment, but, and then view the expert example answer along with ideas to go beyond and red flags to avoid. You know, what are your considerations when you're working with a transgender or LGBTQ plus patient? How would you approach this to provide the best care possible? So I would practice a lot and share those videos with colleagues, review your videos. What's your presence like? How do you look? You know, are you talking at a good pace? Are you using your hands too much? And so on. Because when you're sitting in your MMI, it's very much the same thing. So you can go here, test mode, and you can give yourself 8 questions, just like your interview. Give yourself like a minute to read and practice answering in like only 3 minutes. So you're not going to go over time on the real thing. What experiences have exposed you to other cultures? What did you learn? Right? If you didn't get to your dream med school because your seat was given to an identical applicant who entered via diversity pathway, what would be your thoughts? Crazy questions, all right? And I've been asked these questions. So there's a lot of topics. Not only do you need to understand facts about them, but be able to provide expert opinions on them. So once again, we have, for instance, a question bank on Alberta health policy. All right, let's go reset. So we can go study mode. We don't need to test. Discuss the challenges, opportunities of integrating telemedicine to Alberta healthcare system. We should this one together. Yeah, technological advancements. And there's so many questions that you could work on specific to Alberta, because that's going to be a huge topic. Other provinces, Ontario, Quebec, we got British Columbia, opioid crisis, AI in health, American health policy. This is huge. Why is it important for you to learn American health policy? This is because, well, first of all, there's a whole push being done with privatization of healthcare, and we have questions on that as well, specific to the Canadian healthcare system. I did an exchange in the US, and in all of my health policy questions, I was able to say, okay, well, here's like the current state of Canadian thinking, or the current state of like Alberta's thinking on this topic. But here's what the US is doing. Actually, this has been tried in this state. Here's what the Bismarck system in Germany is doing. Here's what the NHS in England is doing. Here's what Singapore is doing. And I learned about a lot of different healthcare systems in the OECD. Look that up, OECD. And I could use them as points of comparison to see, okay, well, we don't need to really think about this much, because this approach is being done here in this province, in that state, in this country. And it would be like so profound, because I'd almost be teaching them, like in the middle of an interview, they'd be learning from me, because I'd be telling them, well, okay, you know, the other 10 people just had the same answer they read online from some website, right? They sound like GPT, the human version of GPT. So, and I'm telling them, okay, well, no, look at all these other countries and all these other places in the world, and it really, really makes my answer compelling. So learn about other healthcare systems, telehealth, alternative medicine, malpractice, genetic testing, genome editing, CRISPR, vaccine ethics, mental health. So we have a lot of mini question banks in addition to our main one with over 100 questions that provide real-time, researched, expert example answers for you and with ideas to go beyond, so you can stand out and red flags to avoid. We will be giving you a subscription credit to our service right after this webinar along with the slides, so look forward to that. And that is it. Are there any questions for me?